Hi, I'm Marvin Plackett, and today is Tuesday, May 19th. Yes, this is how I walk to get to this location at Episcopal Church Home. Now let me make an adjustment. I wear goggles as well. Be right back. Greetings to all residents, to all staff, and to all guests. Yesterday I reported that we have a total of 17 COVID confirmations. Of those 17, 8 are residents and 9 are staff. Today is a good day. I am very pleased to report that the Seabury resident is no longer on the list because she is back to full health and is no longer contagious. Her doctor cleared her yesterday afternoon. So Irene, congratulations. It's a good day. You know, we're going to have some good days, and we're going to rejoice on those good days. And we're going to have some bad days. And when that happens, we're going to dig deep for strength. So since we have no new cases that have been added since yesterday, I'm very pleased to say that we have 16 COVID cases, confirmed COVID cases presently, instead of 17. Just a reminder that the 7 remaining residents with COVID are at ECH, at Episcopal Church Home. All were in Gilbert House, which is the 3rd floor of Episcopal Church Home. All 7 have been transferred to our dedicated COVID unit for focused care and where the isolation is made easier to keep others safe. Yesterday, I reminded everybody of the very important and encouraging words from Dr. Atul Gawande. He stated them a couple of days ago on Sunday on a CNN news program, Fareed Zakaria. And he reminded all of us how these key features that we have had in place for 2 months, how they absolutely work, how they limit the spread. Testing everybody that comes onto our campus, that includes all staff, before every single shift, to see if they have a fever, and then they have a series of questions to go through to confirm whether or not there's the possibility that they are aware of being exposed to COVID-19. Any symptoms, any potential exposure, they just go straight back home. They don't work the shift. And doing the simple things of contact, whenever there's a case, immediately doing the contact tracing, doing the isolation, frequent washing of hands, staying within our zones, the social distancing, and the wearing of masks at all times when we're not in our offices or when we are not in our apartments or in our units. Those features, those rules, all taken together, that's what makes the difference. No single one alone makes the difference. That's not enough. It doesn't work. But you add them all together, they work. That's the beauty of that kind of comprehensive approach. Just a reminder that if you want to have me address something in particular, or you want to reach out to me, my email address is mplackett@episcopalhomes.org. That's MPLAKUT at episcopalhomes.org. Take care. Look forward to seeing you tomorrow at 1:30. And now for some words from Phil Rose.
Thank you, Marvin, very much. I want to remind folks that in addition to all of the staff that come here and the spiritual life team, there is a whole group of folks that are holding you in prayer and thinking about you all of the time. I had a chance to connect with some of those folks who are volunteers here, including a woman named Anita White. Anita loves to do drawings, and she sent some wonderful drawings of going through COVID. She has some great ones with some toilet paper, etc. She also has some of nurses and healthcare workers that I think are just delightful, and she wanted people to know that she is thinking about them. As well as I spoke today with Deacon Dennis, who is our Catholic deacon, who is eager to get back into the building, and I told him, just hold on, we'll get you here eventually. But he wants everyone to know that he is holding Episcopal Homes in prayer as well. Early on, I shared a poem by a woman named Lynn Unger called Pandemic that has been a popular piece. Last week she wrote one called Badly, which I really like, and I'll say a little bit more about it when I get done. Anything worth doing is worth doing badly. No one ever did it something well without doing it poorly first. But if we're going to get real, the chances of you ever getting really good are slim at best. The Olympics and the pro leagues fled with the end of your puberty. Maybe the Nobel or the Pulitzer is out there waiting, but I wouldn't hold my breath. Even on our best days, most of us are merely competent, and much of the time, adequate is a stretch. Appearances aside, this might be one of the happiest things I know. I hereby resolve you of the need to be better than anyone else. Poof! It is possible to not be very good at things and do it with great love. Grab your uke and I'll grab my mandolin. Meet me on the porch. We'll play together, under tempo, and ever so slightly out of tune. And what I like about that is, yes, she's talking about it as about playing the mandolin or the ukulele, but I think it also has to do with how we're getting through this. Marvin said there's going to be good days and there's going to be bad days. There's going to be days when we feel like we gave the grace that we needed to others, and there's going to be days when we feel like, ooh, I could have just been a little bit more generous. We need to be kind to ourselves and to one another as we go through this together. So be well, and I will be back at 3:30.